Good afternoon. My name is Dr. Jessica Hasson, and I'm a licensed psychologist in Maryland, Virginia, and Washington, D.C. Last board meeting, I spoke about the impact that the pandemic is having on the mental health of our students. I also suggested that MCPS stick with the January 2021 date to bring the most vulnerable students back into the classroom. Last time, I discussed the impact that social isolation has on mental health. Zoom and other platforms allow us to connect, but unfortunately also serve as a reminder of what we've lost and highlight that those closest to us, including our teachers, are no longer easily reachable or accessible. Social isolation can also result in academic disengagement. In addition to teachers not being as easily accessible due to the nature of virtual learning, important aspects of nonverbal communication are lost via Zoom. This makes it that much harder to communicate needs, especially for younger students and those with disabilities who rely more heavily on nonverbal aspects of communication. This communication difficulty can result in academic disengagement, because if the student cannot get the help that they need, why should they try? Data from neighboring school districts shows this evidence of academic disengagement. Fairfax County's data showed significant increase in failing grades from the previous year. The number of students with disabilities failing at least 2 classes over doubled from the previous year, with over 25% of students with disabilities failing at least 2 classes. In other words, over 1 in 4 students with disabilities now have at least 2 failing grades on their record. There was also a 350% increase in the number of middle schoolers failing at least 2 classes. It's clear that virtual learning is not working for everyone, and our students are disengaging from their academics. At the same time, we're battling fear. Fear is irrational and one of the most difficult emotions to tackle because it's so easy to avoid it. With this pandemic, we're being told what to fear by what is open. Bars and restaurants are open, so they must be safe. Schools are closed, so they must be dangerous. This is a logical fallacy, as the decision what to open is not solely based in science, but rather influenced by political leanings, economic impact, and lobbying. Nonetheless, the message to the public is clear. Bars are safe, schools are not. I've had more than one adolescent client ask me why adult socialization is being prioritized over their education, and I have no words. Of course, there is a difference between a healthy fear and an irrational fear. Healthy fear causes us to wear masks in public and follow other scientifically supported mitigation strategies. School districts across the country and the world have shown that we can safely open schools with mitigation strategies in place, including frequent hand washing, wearing masks, using hand sanitizer, and improving airflow by opening classroom windows. In the words of the president of the American Federation of Teachers, Randy Weingarten, "We've learned that if you have the safeguards, like in New York City, schools themselves are not going to be super spreader events." She went on to say, and I quote, "We've learned that remote education for most kids, and frankly most instruction, does not work, and we really need to have in-school learning again. Returning to school needs to be a priority for our students' education, for their future, and for their mental health. MCPS, please bring back our students in January 2021.